In this second section of gastrointestinal pharmacology, we'll discuss laxatives and other types of medications commonly given for gastrointestinal diseases. In this section, we'll discuss laxatives and other miscellaneous gastrointestinal medications. Laxatives are medications that help patients have bowel movements, especially patients that have chronic constipation, whether due to a drug effect or just due to some type of chronic medical problem. Laxatives are divided up into many different types. The major categories, as you see here, are saline laxatives, bulk-forming laxatives or dietary fiber, surfactant laxatives, mineral oil, and stimulant laxatives. The saline laxative that's most commonly given is magnesium sulfate. This is a very powerful laxative. The way these work is by exerting osmotic pressure to retain water in the colon, but these medications can be toxic in patients with renal failure because they can increase the magnesium concentration very highly. Bulk-forming laxatives are simply dietary fiber. Usually these are very safe, they have very few side effects. Surfactant laxatives include medications such as docusate and castor oil. Because they are surfactants, they can actually stimulate intestinal motility because the intestine senses that there is food inside and that it's moving around. These surfactant laxatives can also damage the intestinal epithelium as a side effect and can alter absorption of other medications. Mineral oil is another older laxative that is used to soften stool. Mineral oil can also cause malabsorption of fat-soluble drugs and vitamins because it causes these oil-based vitamins and drugs to stay in the stool instead of being absorbed. Mineral oil, if inhaled or aspirated, can cause lipoid pneumonia. And here's a photograph of lipoid pneumonia here in the right lower lobe of this patient. And then on micrograph, you can see that the oil red O stain of these macrophages can be completely filled with lipids. Stimulant laxatives are used commonly to help patients have bowel movements. Some of the major laxatives in this category are bisacodyl, also known as Dulcolax, Cascara, or anthraquinone such as Senna. These medications will stimulate intestinal motility, but we really don't understand why they work. Importantly, anthraquinone laxatives such as Senna are able to discolor the urine and also can cause melanotic staining of the colon, a situation called melanosis coli. This is something that's usually seen on endoscopy, but it doesn't have any clinical significance. These patients don't usually have any side effects from melanosis coli. We'll talk briefly about laxative abuse. Patients that abuse laxatives usually do so in order to lose weight so that they don't absorb the nutrients that they take in. However, laxative abuse can cause actually malabsorption of nutrients and drugs and lead to nutritional deficiencies. Laxatives can also cause disturbances in electrolytes. Patients that have renal failure should use laxatives with caution. In this section, we'll talk about drugs that are able to treat nausea and vomiting. We call these antiemetics. These medications can work on many different parts of the brain in order to prevent nausea and vomiting. The 5-HT3 receptors in the brain can be blocked by certain antagonists, and the dopamine receptors can also be blocked by antagonists, causing treatment of nausea and vomiting. Anticholinergics and antihistamines are also able to prevent nausea and vomiting by working in the inner ear and the labyrinthine and vestibular systems. We'll start with the 5-HT3 or the serotonin 3 receptor antagonists. The most commonly used medications in this category are ondansetron and granisetron. These medications are used mainly for chemotherapy-induced nausea and vomiting. This medication, when it came out approximately 5 to 10 years ago, was considered a breakthrough in nausea control. This medication is available in orally dissolving tablets, so patients that aren't able to swallow anything can still take this medication and can be effective. The dopamine 2 receptor antagonists, such as prochlorperazine and metoclopramide, are used commonly as first-line agents for nausea and vomiting. Prochlorperazine, or compazine, can also induce dystonias. This medication is actually related to antipsychotic medications, which are dopamine receptor antagonists. Metoclopramide, or Reglan, is very useful specifically for nausea secondary to gastroparesis. Patients that have diabetes will develop gastroparesis and have difficulty swallowing and have difficulty digesting their food. This medication overall stimulates GI motility. This should not be used in patients that have complete bowel obstructions because it can cause severe cramping. Diphenhydramine and meclizine are antihistamines that are very useful for benign positional vertigo and motion sickness. They can cause drowsiness, but they do treat nausea and vomiting related to vertigo and motion sickness. Dramamine is a combination of theophylline and diphenhydramine. The theophylline, which is related to caffeine, is meant to counteract the drowsiness that we see in association with the diphenhydramine. Scopolamine is another medication that's commonly used for motion sickness. This is an anticholinergic medication that may cause drowsiness as well, and this is often given transdermally as a patch. Dronabinol or Marinol is a synthetic THC molecule. This is a Schedule III substance, unlike marijuana, which is considered Schedule I. This medication can trigger a positive marijuana drug test, but it's used to treat nausea and vomiting associated with chemotherapy in patients that have cancer. This medication can also stimulate the appetite. It can cause, in some patients, psychoactive side effects. Aprepitant, also known as Emend, is a relatively new compound that was just approved approximately 4 or 5 years ago. This medication is for chemotherapy or surgery-induced nausea and vomiting. It works by blocking the neurokinin 1 receptor. And the way that it works is by blocking substance P's effect on these receptors. This medication is very good, very potent, but also very expensive. Pancreatic enzymes are other medications that are commonly used in patients that have pancreatic insufficiency, for example, patients that have pancreatitis or cystic fibrosis. These medications include pancreatic proteases, pancreatic lipases, and amylase. And all of these can be packaged together into one pill that's taken along with food, so patients are able to digest food properly, even if their pancreas is not performing their exocrine function that they need. Lactulose is a stool softener, but it's also used in the management of hepatic encephalopathy. Patients that have hepatic encephalopathy generally can develop asterixis and become lethargic, and can even slip into a coma. The way lactulose works is it causes reduced intestinal absorption of ammonia. This medication can substantially reduce ammonia in patients that have chronic hepatic encephalopathy. Patients that have chronic hepatic encephalopathy usually have cirrhosis. Rifaximin is another medication that's commonly given to people with hepatic encephalopathy. This is an antibiotic that's related to rifampin. This medication is also approved for prevention of traveler's diarrhea in patients that are traveling to third world countries in Mexico. This medication is also used widely in the United States for treatment of hepatic encephalopathy. The way that it works is it prevents bacteria in the gut from producing ammonia. And decreased ammonia levels will cause decreased hepatic encephalopathy. Medications used for gallstone therapy include the following medications: the bile acids, chenodeoxycholic acid, also known as Quinodiol, and ursodeoxycholic acid, also known as ursodiol or Actigol. These medications work slowly, so they shouldn't be given to patients as monotherapy that have severe gallbladder disease. What they do is they reduce cholesterol absorption and therefore prevent formation of gallstones. These medications will not work in patients that have calcified or pigmented gallstones. If you can see the gallstone on X-ray, these therapies won't work because any calcified gallstone can be seen in an X-ray, whereas cholesterol gallstones cannot be seen on X-rays. They can, however, be seen on ultrasound. Let's do a gastrointestinal vignette. In this case, we have a 61-year-old male who is admitted to the internal medicine ward for evaluation of weight loss and increase in abdominal girth. This patient is the father of an African student who currently lives in Central Africa, who is here visiting. On physical exam, this patient is thin and emaciated. He has marked jaundice, ascites, hepatomegaly, and pitting edema in the lower extremities. His hemoglobin is low at 6.3 grams per deciliter. He has an increased alpha-fetoprotein, which is a marker for liver cancer, and is elevated AST and ALT. What is the most likely malignancy of this patient? What infections would predispose this patient to development of cancer? And what about dietary factors? Well, the most likely malignancy is liver cancer or hepatoma, given all of his symptoms. Hepatoma is another word for hepatocellular carcinoma. Hepatoma is not benign, even though it sounds like it is. What infections would predispose this patient to cancer? Well, hepatitis viruses, specifically hepatitis C. What about dietary factors? Where there are some dietary factors that can lead to hepatocellular carcinoma, especially the ingestion of aflatoxins. In this case, we do an ultrasound and a CAT scan that show enlargement of the liver with multiple nodules and involvement of regional lymph nodes, which is not a good sign. The liver biopsy in this patient showed hepatocellular carcinoma. And as we talked about before, hepatocellular carcinoma is associated with hepatitis B and C, as well as cirrhosis and aflatoxin exposure. And because this patient is from Africa, we can assume that this patient may have been exposed to the mold Aspergillus flavus, which produces aflatoxins. These are carcinogenic, and hepatocellular carcinoma, because of this, is the most common visceral neoplasm seen in Central Africa from patients that are exposed to these carcinogenic mold byproducts. This concludes our second section of gastrointestinal pharmacology. In our next section, we'll go over medications commonly given for disorders of the musculoskeletal system.